Let's discuss bladder pattern, damp heat in the bladder. Concept: this pattern is ascribed to invasion of damp heat in the bladder. Damp heat impairs the function of the bladder. According to the Sanjo pattern differentiation, it belongs to the lower jaw. The clinical manifestation: there is frequent and urgent urination, distending pain in the lower abdomen, burning pain on urination, scanty dark yellow urine, or turbid or cloudy urine. Hematuria: there is presence of blood in the urine, stones in the urine, fever, distension, and pain of the lumbar region, red tongue, yellow and sticky tongue coating, a slippery and rapid pulse. Key symptoms: there's frequent and urgent urination, burning pain on urination, stones or blood in the urine. Analysis: this pattern may be due to exogenous pathogenic factors or overeating and drinking without control, generating internal damp heat, both of which can cause damp heat brewing and binding in the bladder and lead to abnormal function of bladder chi transformation. So we have here the analysis of bladder damp heat. First, there is failure to transform chi. Abnormal bladder chi transformation, there results to frequent and urgent urination, burning on urination, dark yellow urine. If there's damp heat that evaporates body fluids after a long time, it develops to a stone in the urine. Under bladder damp heat, if there is damp heat in the bladder, there could be damp heat that induces fluid resulting to a scanty urine. Damp heat damages the blood network, results to blood in the urine. If there's heat, steams dampness, there is fever. Damp heat damages kidney, there is back pain. There's red tongue, yellow and sticky tongue coating, a slippery and rapid pulse. Identification: these patterns of bladder damp heat and excessive heat in the small intestine pattern have common symptoms such as frequent and urgent urination and burning on urination. However, the latter is due to heart fire moving downward to the small intestine and includes heart fixation, thirst, insomnia, and ulcers in the mouth and on the tongue. While the former pattern is caused by bladder damp heat accompanied by kidney disease manifestations such as fever, soreness of the lumbar region, etc. Because the kidney is related to the bladder in both the interior and the exterior and by the channels and collaterals. For the summary of damp heat in the bladder, the etiology: there is excessive exposure to exterior damp heat or dampness or cold emotional strain. Underlying or accompanying pathology: there is dampness and heat in the bladder. Possible presenting conditions: urinary tract infection or urinary calculus. Signs and symptoms: frequent and urgent urination, burning urination, difficult urination, dark yellow turbid urine, blood in the urine, fever, thirst with desire to drink, hypogastric fullness and pain, feeling hot, sand or stone in urine. Pulse: there is slippery, rapid, and wiry on the left rear position. The tongue is thick, sticky yellow coating on the root with red spots. Treatment principle: there is clear heat and disinhibit damp in the bladder. Free waterways, disinhibit water, and free lymph. Acupuncture treatments: we use spleen 9 for damp heat in the lower burner. Bladder 22 opens lower water passages. Stomach 28 regulates the bladder and urination. Bladder 28, dampness in the bladder. Spleen 6 for damp heat in the lower burner. Ren 3, front move point of bladder. Ren 9 resolves general dampness. Needle with drainage: for small amount of red in the urine, we use DO 27. For pain in the urination, we use liver 5, liver 2. For blood in the urine, we use spleen 10 and bladder 60. Relevant advice when there is urinary bladder damp heat: The person should avoid foods and beverages that generate damp or heat. They should avoid exposure to climatic influences that can result in damp, heat, or cold invading the body. They should also avoid stress and situations that can result in emotional frustrations. Thank you for your attention.